Bismillahirrahmanirrahim. Assalamu alaikum. A 43-year-old woman is being evaluated on the surgical floor for increasing shortness of breath. She was brought to the emergency department 8 hours ago following a high-speed motor vehicle collision. The patient had been drinking alcohol prior to driving. She was restrained and the airbag deployed, but her right knee struck the front console. Trauma workup revealed a right femur fracture as well as bruising of the face and chest without underlying fracture. The patient received 3 liters of isotonic fluid and was admitted for observation and pain management prior to anticipated fracture fixation. She now has increased work of breathing. Blood pressure is 138/82, pulse is 102, and respiration are 24 per minute. Pulse oximetry showed 90% oxygen saturation on 4 liters of oxygen. The patient is alert with no focal neurologic deficit. Diffuse rail are heard and the anterior lung filled bilaterally. Heart sound are normal. There are no other changes since the initial evaluation. CT scan of the chest revealed peripheral anterior ground glass opacities in both lungs. Which of the following is the most likely diagnosis in this patient? So this patient is a 43-year-old woman. She is brought to the emergency department following a high-speed motor vehicle collision. She is being evaluated for increasing shortness of breath. Trauma workup revealed a right femur fracture as well as bruising of the face and chest wall without underlying fracture. The patient received 3 liters of isotonic fluid and received pain medication. After that, she now has increased work of breathing and respiratory rate are 24 per minute, pulse and oxygen saturation is 90% with 4 liters of oxygen support. On auscultation, there is diffuse rails are heard and the anterior lung filled bilaterally. CT scan of this patient chest reveal peripheral anterior ground glass opacities in both lung field. Based on these hint, the sign and symptom of this patient, the diagnosis of this patient is pulmonary contusion. And here the correct option is choice E, choice F, pulmonary contusion. Why the choice F is the correct one? Because this patient sustained blunt thoracic trauma with chest wall and facial bruising from airbag impact, blunt force resulting in alveolar hemorrhage and edema. Subsequent resuscitative fluid administration can exacerbate the alveolar edema, as this patient received 3 liters of isotonic fluid, which leading to progressive dyspnea, tachypnea, and hypoxemia. On CT scan, the alveolar edema can appear as ground glass opacities in the lung adjacent to the affected chest wall. This pattern and distribution are classic for pulmonary contusion. Pulmonary contusion is common as, for example, 25 to 35% of cases following blunt thoracic trauma. Clinically significant alveolar edema may take up to 24 hours to accumulate. Pulmonary contusion may not be apparent immediately after an injury and initial chest x-ray is often negative. Management for pulmonary contusion involves pain control, pulmonary hygiene, and respiratory support. Come to the incorrect one. Choice A, aspiration pneumonia. So patient having aspiration pneumonia, is patient will also have tachypnea, hypoxemia, tachycardia, but together with these symptoms, patient will have fever, productive cup, as this patient didn't have. So this is another diagnosis of this question. Choice B, bronchial rupture. So patient having bronchial rupture on CT scan or on X-ray, the patient will have pneumothorax and pneumomediastinum. Choice F, PET embolism syndrome. So as we can see here that this patient has right femur fracture, and the patient will most probably with PET embolism syndrome most probably will have tachypnea, tachycardia, hypoxemia. But PET embolism syndrome, the sign and symptom will occur after 24 hours from the trauma. This patient come directly to the emergency department, so this diagnosis is unlikely for this patient. Choice D, hemothorax. So patient having hemothorax on CT scan, there will be pleural effusion. The patient having hemothorax. This patient didn't have hemothorax, so this is not a diagnosis of this question. Choice E, myocardial contusion. Patient having myocardial contusion, the patient will present with hypoxemia, tachycardia with hypotension. The patient with myocardial contusion will present with cardiogenic shock and hypotension. Thank you. Sorry. So I will show the photo of the pulmonary contusion. I forgot in that. So let's discuss here. This is the classic picture for the pulmonary contusion, which show that there is an irregular non-lobular infiltrate in the peripheral of the lungs. I will highlight here. The red one is the irregular non-lobular infiltrate in the periphery of the lung. This is classic for the pulmonary contusion. Thank you.